Detox off of Suboxone is one of the most difficult situations that we've encountered in addiction medicine and psychiatry. Suboxone is a very useful medication for the treatment of addiction and for opiate detox. However, one of the consequences of Suboxone maintenance is that it can be difficult to come off of Suboxone for certain patients, at which time it is appropriate for them to come off. Now, difficult does not mean impossible. Just like coming off methadone is difficult, but it's certainly not impossible. What it involves is just not the standard approach to coming off of conventional opiates. Coming off of Suboxone, more specifically the active ingredient buprenorphine, can be done in a methodical, technical, specific manner that might be a little different from person to person. The approach usually starts with a weaning down to a smaller dose of buprenorphine, and then the approach will be different from person to person depending on what the specific factors and variables are for that given patient. Each approach will tend to be a little longer or shorter depending on the needs of that individual. I discourage anybody from using a kind of generic textbook approach for any patient because each person will have different needs. Some of the bigger needs that people will have are based on how long the lingering withdrawal symptoms will persist in any given person. If the detox is done poorly, they will have a long post-acute withdrawal phase, which is very uncomfortable and is a major trigger for relapse. If done properly, the post-acute withdrawal will be much shorter and can be resolved completely, and the person will have a much better prognosis. It can be done. It will take time. It will take longer than a week or two, which is why that particular kind of detox is best done as an outpatient, where you don't have the same time pressure to come off of a medication within 5 to 7 days.